Our next speaker is Dr. Jade Hagan. Dr. Hagan is a postdoctoral fellow in the program in Writing and Communication at Rice, where she teaches courses in environmental and health humanities. Her research focuses on romantic literature and its global reception, specifically romantic and post-romantic challenges to received ideas about materialism, ecology, and agency. More recently, she's increasingly interested in bringing the environmental and health humanities into conversation with one another. Her work has appeared in Configurations, a journal of literature, science, and technology, Blake, an Illustrated Quarterly, Romantic Literature of the Western Hemisphere, and Magic, Ritual, and Witchcraft. The title of her talk today is Mindfulness, Mental Health, and the Nonverbal Humanities. We wanted to welcome Dr. Hagan.
Thank you, Arnav. I'm going to try to work with this PowerPoint and see how it goes. I was having a little bit of trouble, so if I can't get it to work, I'll just send it to you all in the chat. So let's try this. And pardon me. Yeah, this
We see it in presenter view.
Yeah, this is not really what I was looking for. Okay, let me try one more thing. Sorry for the delay.
No worries.
I had it working earlier, but then I was also getting this. You know what? I think I'm just going to speak, and I'm going to share this in the chat right now, and you guys can follow along. Really, all it has are quotes. So I don't really have any images. So I'm going to share that, and as soon, oh, I can't share it. I'm not sure how to do that. Anyway, maybe I can send it to you after I finish talking. All right, without further ado. So I will just get started. So thank you for the introduction. And thank you for having me. My talk today comes out of a course that I've been teaching that Arnav, for instance, knows about here at Rice for a few years, called Mindfulness in Medicine, and the research that went into designing that course. I'll be drawing connections between the terms in my title, mindfulness, mental health, and the nonverbal humanities, to demonstrate what these concepts and practices might have to offer to medicine, medical humanities, and frankly, all of us as we navigate this extraordinary year. I had long been interested, as Arnav mentioned in the intro, in the certain overlaps between medical humanities and my first area of expertise, which is the environmental humanities. Namely, I was interested in the relevance of the mind-body connection to both fields. But my real introduction to medical humanities came through teaching. First as a TA for Dr. Astaire and her medicine and media course. Then I taught literature and medicine in the English department, and now I teach a FWIS course, the Mindfulness in Medicine. I got interested in mindfulness about 7 years ago as a tool for coping with the stress of grad school, starting a PhD program here at Rice. But my appreciation of mindfulness really changed with this course and the response that I've gotten to it, which has just been tremendous. The class inevitably fills up every semester. I get tons of emails begging me to sign special registration forms, telling me that they've heard the course is life-changing. And so clearly I was tapping into a widespread and unmet need for courses that deal with mental health issues and that address other big questions about what makes life meaningful. And even though I've been practicing mindfulness meditation off and on for the last 7 years or so, I really recommitted to the practice back in the spring when the pandemic started. And part of the reason why mindfulness as a practice seems so appropriate for the moment has to do with the preponderance of our mental lives during this pandemic. The way that the pandemic's forced a whole new level of introspection and intimacy with our inner lives, of thought, emotion, and impulse. It seemed to me that there's a real disconnect. There has been a real disconnect between the raucousness of the events of the world in the past year and the relatively restrained and isolated ways in which we've been experiencing them, which is mostly at home with the few people we live with, if anyone at all. People are desperately searching for ways to grapple with the pain and loss and anger and grief that we're all experiencing on collective and individual levels. But much of this reckoning goes on internally and so invisibly. Back in the spring of 2020, I know that there are others out there thinking like me, because I ordered a dozen or so books to settle in with and wait this pandemic out. And of the dozen, there were two that were back ordered. One was called The Art of Solitude, and the other one was called How to Do Nothing. So it seemed many others were also struggling with how to shift out of a lifetime of doing to one of just being. And of course, one of the outcomes of this pandemic and this new and intense awareness of our inner lives has been a worsening of the mental health crisis, which the WHO in 2017 called the leading cause of ill health and disability worldwide. This pandemic's exacerbated mental health for nearly everyone. I think we are only just beginning to grasp the gravity of the crisis, the mental health crisis brought on by COVID. And that being the case, I do today just want to focus on two groups that have been hit particularly hard. And those are frontline medical workers and people of color. And everything in the section is drawn from some New York Times articles, and I'll be quoting a few of the doctors mentioned in them. So on May 13th, 2020, the WHO released a report on the mental health impacts of the pandemic, and it highlighted healthcare workers as especially vulnerable. In interviews with frontline workers here in the US, more than 24 described the unrelenting stress that's become an endemic part of the healthcare crisis. Many also reported soaring rates of anxiety, depression, burnout, and a persistent sense of hopelessness and deepening fatigue. Here are some of these medical workers' statements. A chairman from an emergency department wrote, "What's left are the emotions of dealing with the trauma and stress of the many patients we cared for. There's a wave of depression, letdown, true PTSD, and a feeling of not caring anymore that is setting in." In a Facebook post, a paramedic wrote, "Screw all of you. Now I see exactly why the only thing left to do is suicide." End quote. And finally, a paramedic firefighter wrote, "We are a lot quicker to be angry with each other. Any little thing sends us over the edge. But among the older guys in their late 30s and 40s, it's not okay to talk about things. So all anyone talks about is alcohol." Many have also recoiled from the hero label that we saw so often, particularly in the spring, and that's emblazoned on ad campaigns. For instance, a critical care physician at Baylor College of Medicine here in Houston was haunted by the events of last summer. He inadvertently brought the coronavirus home to his family and sickened them all. "I felt so guilty," he said. "This is my job, what I wanted to do for a living. And it could have killed my children, could have killed my wife, all this because of me." So with all of these stories in mind, and obviously these are just 4 of them, therapists around the country have been lining up to offer free treatment to medical workers. But reportedly, the number of requests has been fairly modest. This is due in part to a trope of invincibility that's long been ingrained in the culture of medicine. As one psychiatrist at Rutgers Medical School put it, physicians are often very self-reliant and may not easily ask for help. Of course, this only adds to the internal load these doctors are carrying at this time. And yet, many of these workers worry that seeking mental health support could tarnish their records and dissuade future employers from hiring them. This is because many state medical boards still ask intrusive questions about doctors' past mental health diagnoses and treatment in their applications to renew their license, which of course is a disincentive to those who might otherwise seek professional help. Turning to people of color, we've seen how mental health impacts exacerbate existing inequalities. Between the disproportionate toll of the coronavirus on Black people, Hispanic and Native Americans, and the Black Lives Matter protests last summer, Black people in particular have a whole new set of stresses. Even Michelle Obama has said publicly that she's been dealing with low-grade depression. In the Black community, however, mental health is often stigmatized. It's a topic that not many people talk about. I actually had a student who did a project on this. It's seen as something for, getting help is seen as something for people who can't handle their own challenges. Sean Fletcher, who's a professor at San Jose State University, argues that much of the way African Americans deal with mental health or choose not to is based on how we are socialized. Within Black culture, many are taught they don't have the privilege of being vulnerable like other communities. They've been taught to find strength in their faith. And of course, they've been taught by history that the medical system can't be trusted. For many Black people, these issues are compounded by a lack of access to mental health services in their communities, as well as a lack of representation. According to a 2018 report from the American Psychological Association, only 4% of therapists are African American, while African Americans account for roughly 14% of the population. All the foregoing, and this last year with the pandemic, and conversations around race and racial justice have shown us anything, it's that the virus isn't the greatest obstacle we face. And this is a key claim I want to make today. The greatest obstacle is culture. Culture is the most resistant aspect to change. So we need to begin to see mental health as much as a social and cultural issue as we do a medical issue. And it is a medical problem, because even those who do seek help aren't guaranteed any quick fixes. The truth is we don't have good treatments, many good treatments for mental health conditions. We have medications that work for some, but not others, and with side effects that deter people from even wanting to try them. In fact, in 2015, Michael Pollan interviewed Tom Insel, who was at the time the head of the National Institute of Mental Health. And Insel told Pollan, you know, you have no idea how poor our tools are and how broken mental health care is. If you compare mental health treatment to any other branch of medicine, oncology, cardiology, infectious disease, we have achieved so little. We have not lengthened the human lifespan. We have not substantially reduced suffering the way these other branches of medicine have. So it's no accident that we were able to produce a COVID-19 vaccine in less than a year, but our treatments for mental health are rudimentary at best. It's no accident that we spend so little of our government and healthcare systems resources on mental health research and care. These gaps in healthcare reflect the fact that we live in a culture in which mental health is not only overlooked, but actively subordinated to physical health. Aldous Huxley made a similar argument about our culture's failure to appreciate certain dimensions of ourselves and our inner lives. In a 1962 article called Education on the Nonverbal Level, which is one of the first things my students read in my course, Huxley argues that our culture's tendency to privilege knowledge and mastery of the external world has led us to forget how to tend to the internal dimensions of our lives that can't be so easily controlled or represented. Emotions, pains and joys, drives and aversions. What he sums up as the world of unconceptualized nonverbal experience. Huxley's clear that an education in the nonverbal humanities would go beyond the purely symbolic realms of both the sciences and the humanities, because both deal in symbols, whether numbers or words. His aim instead is a, quote, thorough training in elementary awareness, a systematic training of perception with techniques for heightening awareness of internal events and for improving awareness of external events as these are revealed by our organs of sense. It's a kind of mental training that he's arguing for. And he didn't use the term mindfulness in this 1962 article. That concept wasn't available to him at that time. But his argument for nonverbal education provides an important precedent and basis for understanding the explosion of interest in mindfulness meditation decades later. And I want to be clear that mindfulness is not a panacea. It's not a substitute for medical opinions. But my claim today is simply that it is one example of a technique that we can use to cultivate these nonverbal humanities, this mental training that Huxley is advocating. So I'm sure many of you are familiar with mindfulness, have probably seen it, heard it, if not practiced it. But for those who aren't familiar, mindfulness meditation is defined as the practice of paying attention in a particular way, on purpose, in the present moment, and non-judgmentally to our moment-to-moment experience. That's defined by Jon Kabat-Zinn, who I'll say more about in a moment. So students in my course learn about the nonverbal humanities and mindfulness meditation through assigned literature, art, and film, and of course through their own experience of meditating for 30 days. That's one of the course requirements. They developed this 30-day meditation practice. And this year I was really fortunate to be able to offer my students a free one-year subscription to the 10% Happier meditation app, which I really like because it features these courses with evidence-based and with academic researchers who study the science of meditation. So many students are surprised to learn that the popularity of mindfulness in the West stems in large part from its medicalization, specifically from Jon Kabat-Zinn's development of the mindfulness-based stress reduction protocol, or MBSR, as it's often called, in 1979. MBSR became influential in what was then a new branch of medicine called behavioral medicine, or more broadly, mind-body or integrative medicine. From the perspective of mind-body medicine, mental and emotional factors, the ways we think and behave, can have a significant effect on our physical health and our capacity to recover from illness and lead satisfying lives in the face of chronic disease and chronic stress. This view, which was radical in 1979, has of course become much more mainstream in medicine in the decades since. And the science of mindfulness has empirically shown that meditation has a wide range of health benefits. So just to tick through a few of them, mindfulness has been shown to reduce levels of depression and anxiety. It helps control or manage chronic pain. It's been used to treat addiction. It has been used to treat insomnia and improve sleep. It's been shown to increase neuroplasticity. And there's some evidence that it both reduces inflammation and maybe even boosts the immune system. Crucially, mindfulness is also accessible to anyone of any age or socioeconomic background, ability. It's free and immediately available to anyone who wants to practice it, no equipment required. But aside from these health benefits, a key theme throughout the course I teach is this idea that the most meaningful and impactful moments of our lives are those that deal with existential issues that often arise around health concerns such as this pandemic, issues such as life and death, relationship crises, crisis of meaning in our lives or of purpose. Our culture and our traditional education systems just don't teach us how to reckon with these issues. And as we've heard before, neither does medicine. And so part of the purpose of the course is to not only help students learn about the applications of mindfulness in a medical or health setting, and not only to help students cope with stress or prepare for trauma. It's also to provide them with a chance to think about, what does it mean to survive as a human? How have people dealt with these issues in the past? And what can we learn from them? So the main takeaway I want you all to get from this talk is that teaching this course and researching and practicing mindfulness have affirmed for me that mindfulness and this broader notion of the nonverbal humanities, or this need for a mental training, these are important concepts for clarifying and addressing the most important existential questions we all face. Questions that, unanswered, may negatively impact not only our mental health, but also the quality of our life and the degree to which we consider it meaningful. So as an analog to the list of health benefits I described earlier, here are just a few of the what I'm calling the existential benefits of mindfulness meditation. Mindfulness meditation enhances self-awareness. It aids in self-discovery. It sharpens our attention and our ability to direct what we pay attention to, because the more you observe your mind, the more power you have to choose how you live each moment. It increases resilience to stress and negative emotions and helps with emotional regulation. One of the things that Dan Harris, who did the 10% Happier app, always says is that mindfulness helps us not to be so yanked around by the emotions. So it's not about suppressing thoughts or suppressing emotions, but just being able to distance ourselves a little bit. It increases compassion, may reduce loneliness, and it has a positive impact on relationships. So in closing, I just wanted to share a few student narratives. I have them do the self-evaluation of their mindfulness practice because it's hard for me to evaluate a meditation practice in a course. So I'll just share two of them for time's sake. And these are from the fall of 2020. So these are first year students. This is their first semester of college coming in this pandemic. One student wrote, "Meditation's impact on me has been very subtle, but definitely noticeable. The night before my biology midterm, I ended up meditating and doing 2 different sessions. It helped me calm my mind down and focus, and definitely took weight off my shoulders. Overall, I've noticed that meditation allows me to put things into perspective. That moment of peace and focusing on my breath makes other things feel simpler or less complicated. It's brought to my attention just how much I tend to stress over things that don't need much of my focus. Moving forward, I definitely will be continuing my meditation practice." So that was one. So the last one, it's kind of long, but I think it was very impactful for me. So the student writes, "First off, I'm going to come clean and say I took this course for the medicine aspect and less so for the mindfulness aspect. So I was definitely very skeptical when it came to the meditation assignment. Basics 1 and Basics 2, which are these courses in the app that everyone takes together, gave me a set time every night when I could calm down and take 10 to 15 minutes to sit and think about my day. Nothing huge, but it really reintroduced some sort of control back into my life during my transition to college. After the 15-day mark, I tried out the emotions program by Oren J. Sofer. I thought it'd be similar to Basics 1 and 2. I was very wrong. For backstory, in high school, I was very shy, not someone you'd see out trying Rice's Screw Your Roommate events or meeting new people and fun in the quad on Fridays. More likely, you'd see me in a calculus classroom during lunch, eating by myself or with a few friends, playing the same video games on our phones that we've been playing for years. I didn't talk much in group projects, and I'd always head straight home after school. With this in mind, I'm not saying switching meditation programs created an extraordinarily confident, not afraid of anyone or anything social butterfly, but I definitely say it helped me tons with my social anxiety. Here I've got to give credit to my favorite lesson. Don't take yourself too seriously. Where Sofer talks about using humor to be aware of and deal with current situations and emotions. I really internalized this lesson as I started to talk to people more and use humor to diffuse awkward conversations. I learned that people are a lot more comfortable in conversation if I too am comfortable. I began being myself, and slowly I saw the fake social mask I was so fond of in high school come off. After I started saying what I wanted to say and being who I really was, I noticed people were a lot more open with me. Conversations stopped feeling like chores, and now I find joy in talking with new people. I'm excited to learn about this weird, quizzical, non-socially anxious version of me that I've never seen before." So if that's not a testament to the power of mindfulness in these difficult times, I don't know what is. And that is end of my talk. Thank you. I will look forward to the questions.
Thank you so much, Dr. Hagan, for your insights on how mindfulness, as well as Aldous Huxley's concept of the nonverbal humanities, can help us to address the global mental health pandemic.